This video is about heart rate, pulse rate, respiratory rate, stroke volume, ejection fraction, and cardiac output. Now, first of all, we must know that all these are a result of cardiopulmonary system function, that is, the cardiovascular system and respiratory system coordinated function. So anyways, we'll first start with the heart rate. So heart rate is the number of times the heart beats in 1 minute, or in other words, you can say it's the number of heartbeats in a minute. You have the heart beating, and those number of beats it produces in a period of a minute are termed as heart rate. So the normal heart range ranges from 60 to 100 beats per minute, and its average is 72 beats per minute. And if the rate has to be normal, then it has to be regular. That is, need to be maintained at a relatively constant rate. Why is it important to know of heart rate? For that, let's look at the significance. So an accelerated increase in heart rate more than 100 beats per minute is termed as tachycardia, and this can be due to a number of conditions or reasons. Could be normal, that is physiological, or could be abnormal, pathological, or by drugs, pharmacological. So this heart rate could be physiological in infants, because infants naturally have a higher heart rate due to the high metabolic rates as they need to grow constantly. So their tachycardia can be around 160 beats per minute. In exercise also, you have physiological rise in the heart rate because of the body's increased demand to oxygen and nutrient need. In short, increased metabolism. In pregnancy, you have the same. And also in emotion, anxiety, you have the same, an increase in metabolism. And also another physiological cause could also be dietary, that is coffee intake. Moreover, the pathological causes can include the cardiac disorders. This can be disease of the valves, valvular diseases, or disease of the heart muscle myocardium, cardiomyopathies. And there are a lot of variety of diseases including fever, anemia, hypoxia, hypothyroidism. There's too much thyroid in blood. Catecholamines also, that is adrenaline, or epinephrine or no epinephrine, just the same thing. Pharmacologically, the heart rate could be high due to stimulants, that is intake of drugs like epinephrine. Another significance is an exaggerated decrease in heart rate below 60 beats per minute, we term that bradycardia. So that's the decrease in heart rate below 60 beats per minute. So this equals several causes and can be equal as physiological in sleep and in athletes. So generally athletes have a low heart rate in general. So that means an athlete should be suspected of having a bradycardia if they're not accompanied by symptoms, obvious symptoms. Moreover, the heart rate is also lower during relaxing and can be pathological when you have conditions like hypothermia, that is low body temperature, hypothyroidism, low serum thyroid, degeneration, that is during degeneration as the person ages, and also increase in intracranial pressure. Now remember that intracranial pressure is in direct relation to the vagus center in the CNS. So as such, increase in the intracranial pressure has a direct effect on the vagus nerve, activates the vagus nerve. So as such, the heart rate slows down. Remember, vagus brings parasympathetic activity, relax and digest activity. Other cardiac defects include MI and slow response blocks. These can also be some causes. Now, the pharmacological causes will include beta blockers, which are pharmacological drugs that attach to beta receptors to prevent adrenergic activity. Remember that beta receptors are adrenergic receptors. When we have calcium channel blockers, which do so by decreasing the amount of intracellular calcium. And we have digitalis, which is a positive inotrope but a negative chronotrope. Decreases heart rate but increases force of contractility. The next is pulse rate. Pulse rate is the number of pulses in a minute. Now, we must know that pulse rate is an accurate measure of heart rate in physiological conditions. In a physiological condition, the heart rate and the pulse rate are just the same thing. So this can easily be determined from the arteries, since arteries are most discernible. So this means, if we're talking about sensibility, this means that capillary pulse is practically hard, since they're not discernible. So some points where you can measure the pulse rate includes the radial artery, carotid artery, brake artery, dorsalis pedis, popliteal pulse, and tibial pulse, etc. So just remember the pulse rate and heart rate are physiologically the same in physiological conditions. So it's just that the units are different, but otherwise they are just the same. Pulse rate will be measured in pulses per minute, heart rate will be measured in beats per minute. Then the next thing is the respiratory rate. Respiratory rate is the number of breaths per minute. Hence, this concentrates on respiration. It's the number of breaths per minute. Hence, this concentrates on respiration. That's the oxygen intake and carbon dioxide metabolism. That's the outtake. The oxygen intake, carbon dioxide outtake. That kind of a process. The normal respiratory value is around 12 to 16 breaths per minute. So, with that said, let us look at a quick recap. You have a heart beating that is called heartbeat, and the number of these beats in a minute is known as heart rate. Now, the heart action sends certain waves of pressure around the body, and those pressures are known as pulses, and those pulses are proportional to the heart rate. Then the next thing we look at is stroke volume. Now, well, the heart pumps a certain volume of blood into circulation per contraction or per beat. So that volume is termed as stroke volume and is measured in milliliters per beat or liters per beat. So stroke volume is the volume of blood per beat. So to understand, let's look at the overview of your heart physiology at the point of ventricular contraction, ventricular systole. Firstly, the ventricles are fully filled with blood, and this closes the atrioventricular valves, that is the mitral and the tricuspid valve. That volume of blood at the end of diastole is end-diastolic volume. Then we have a contraction with both valves closed. That's the atrioventricular and semilunar valve, aortic and pulmonary. So the pressure in the ventricles increase with no increase in the blood volume. C. The chamber blood volume hasn't changed since there is no inflow or outflow, and that is called isovolumetric contraction. Iso means same, volumetric means volume, contraction, systole, just the same thing. So contraction continues until the pressure is enough to open the semilunar valves with contraction of ventricles, till the pressure is enough to open the semilunar valves and the blood is pumped out. So the blood pumped out is called the stroke volume, while the blood remaining is the end systolic volume, since it's at the end of systole. So with that kind of reasoning, we'll say that stroke volume is equal to end diastolic volume minus end systolic volume on each ventricle. But significantly, we consider left. So the mean value will lie around 70 to 80 millimeters per beat. Now, in order for us to move on ahead, we must know that the stroke volume can be expressed as a percentage and will be called ejection fraction. So ejection fraction is the percentage of blood ejected of each ventricle per beat, that is per cardiac cycle. And this will be calculated by ejection fraction is given by stroke volume over end diastolic volume times 100. But stroke volume, is end diastolic minus end systolic volume. So therefore, we're saying the formula can also be expressed as ejection fraction is end diastolic volume minus end systolic volume over end diastolic volume times 100. And that normal value will be at least 50%. From 50% going up. Remember, we've been looking at stroke volume, and that is the volume per beat. How about in a minute? Have you ever thought about it? And that in a minute is expressed as cardiac output. So cardiac output is the volume of blood, or it is the amount of blood that is pumped out of each ventricle in a minute. And this will be measured in millimeters per minute. And this cardiac output is given by heart rate times stroke volume. And the average will lie from 5 to 6 liters per minute, or 5,000 to 6,000 millimeters per minute. So anyway, this is just a brief introduction about each of the components. For more information, we'll make another video on these individual components. Thank you.